Hi everyone, it's Dr. Tim Kwan from Rheumatology Specialists of Connecticut and Caitlin Carpenter, our physical therapist. We're going to teach you some exercises for the hip. We've had a plague of patients who've been coming in with terrible pain in the hip and down the side of the hip. So let's get started. Caitlin.
The first thing that we're going to start off with is some gentle stretches that you can do for your IT band and your tensor fasciae lata, which attaches it to the hip. So first I'm going to ask Dr. Kwan to lay on his back on a table. Okay, and you can also do these in sitting if you don't feel comfortable lying down. But he's going to bend one knee up, and then he's going to place it on the table, and then he's going to cross the other side over the top of this knee, like a figure 4. And then he's going to press down on this knee to give a stretch in the hip over here. And I like to tell people to hold for about 30 seconds a couple of times, okay? And then also what you can do to make it a bigger stretch, you can bring both legs up towards your chest. Nope, keep that up there. Yep, grab around the back of the thigh, and then bring up towards your chest. So you should feel a little bit of a deeper stretch down the side in the hip, okay? Perfect. And then the last one, Dr. Kwan's going to take his belt off. If you have a belt at home, this is perfect, or a strap. Going to make a little loop in the end. Okay, put it around your foot and lay back down. And you're going to straighten that leg and then pull it across the other side, just like that. So you should feel a stretch on the side of your leg.
Whoa!
Yeah.
Now, when we're doing these, how many of these should I be doing to kind of stretch it out?
You should be doing at least 2 times of 30 seconds.
Oh, I see. So hold it like this.
Yeah. Yes.
All right.
Okay, and another big part of your hip pain is strengthening, because a lot of times our hips can get very weak. So I'm going to show just a few exercises for hip strengthening as well. Okay, so you can take the belt off, then you can lay back down again.
Okay.
You're going to keep your both knees bent up this time, feet flat on the table. And now we're just going to perform a bridge. So you're going to bridge your butt up into the air. Good, and give a good squeeze.
Squeeze in the butt?
Yep, and back down. For those of you that might have some back pain, you don't have to go quite as high, but you can just lift a little bit off the table and still squeeze those glutes. Okay?
How many do I need to be doing here?
I would also like you to do about 30 of these at a time, and you can do those once a day.
30?
Yes.
And for how long, like each bridge?
Just give it a little bit, like a 1 to 2 second hold.
1, 2.
Perfect. All right, then I'm going to ask Dr. Kwan to roll to his right side.
Okay.
And this next exercise is called the clamshell, and it strengthens the hip rotators. So he's going to keep his knees bent, and the top one is going to lift up and back down, just like a clamshell. And same thing, you're going to do about 30 of these.
Okay. This isn't that easy, actually.
No, it's pretty difficult if you haven't done it before. All right, how does that feel?
Pretty tight, actually.
Yeah, so you could use some of those stretches that I just showed you. All right, so the next one, you're going to stay on your side, straighten the top leg, and then you're going to lift the top leg up in the air, just like that. And back down, and again.
Do I need to point my toe anywhere? Or
you should point your toe towards the middle, like down towards the ground a little bit, so you're getting your hip and not so much your hip flexor.
Whoa.
Yes. And it's really important not to roll your pelvis back, kind of like he's doing right now.
Oh, don't do that.
So you want him to come forward like this.
Whoa. That, I can really feel. Oh, I'm sorry, Caitlin, I think I kicked you.
Perfect.
And how many do you want?
30.
30.
Yes.
So we could build ourselves up, say, 10 or 15
Sure.
and build ourselves up?
You can do sets of 10. And
See,
then
if Dr. Kwan can only start with 10, don't feel bad.
Okay, and I think we're good.
Thank you so much, Caitlin.
Thank you, everyone. Whoa, no.